Welcome to Molan Health. Today we're diving into an important topic that affects many women: menstruation and polycystic ovary syndrome, or PCOS. It can be a bit confusing, right? We're going to break it down, talk about what's going on in your body and what you can do to feel your best. We're going to cover the basics of the menstrual cycle, what PCOS is, what causes it, and most importantly, the treatment options available. So whether you're personally experiencing these issues or just want to learn more, then stick around. This video is for you. All right, let's break down menstruation, what we often call that time of the month. Essentially, it's your body's way of preparing for pregnancy. Every month, the lining of your uterus thickens, getting ready for a potential fertilized egg. If pregnancy doesn't happen, that lining sheds, and that's your period. Now, you've probably heard of estrogen and progesterone, right? These hormones are like the conductors of your menstrual cycle. Estrogen helps build that uterine lining, while progesterone steps in after ovulation, getting everything ready. We're talking about a delicate dance here. The average menstrual cycle lasts about 21 to 35 days, but it can vary from woman to woman, and even in your own body, month to month. Periods typically last anywhere from 3 to 7 days. The key here is to know your cycle. What's normal for you? Now, let's talk about PCOS, or Polycystic Ovary Syndrome. This is a hormonal disorder that affects many women, often during their reproductive years. Imagine your hormones are a team, right? With PCOS, that team isn't quite working together as it should. One of the hallmarks of PCOS is irregular periods. We're talking cycles that are longer, shorter, or just all over the place. Some women with PCOS might even stop having periods altogether. Another common symptom is excess androgens, which are male hormones. This can lead to some things you might not expect, like acne, excess hair growth on the face or body, and even hair loss on the scalp. Chapter 3. Causes of PCOS, Unraveling the Mystery. So, what causes PCOS? Well, that's the million-dollar question, and unfortunately, we don't have a single clear-cut answer. It's likely a combination of factors, kind of like a perfect storm brewing in your body. Genetics definitely play a role. If your mother or sister has PCOS, you're at a higher risk. Another big player is insulin resistance. This is where your cells don't respond to insulin as well as they should, which can lead to higher levels of both insulin and sugar in your blood. And guess what? That can mess with your hormones too. Inflammation is also on our radar. Research suggests that women with PCOS tend to have higher levels of inflammation in their bodies, which can contribute to the development of the condition. Chapter 4. Taking Charge: PCOS Treatment Options. Okay, so you've been diagnosed with PCOS. What now? The good news is that there are many ways to manage the symptoms and improve your quality of life. First and foremost, lifestyle changes are key. Think of it as setting a strong foundation for your health. Losing even a small amount of weight, if you're overweight or obese, can make a big difference in managing your symptoms. Regular exercise, even just 30 minutes most days of the week, can work wonders for your hormone balance and insulin sensitivity. And of course, we can't forget about diet. Focus on whole, unprocessed foods like fruits, veggies, lean protein, and healthy fats. Your health, your journey. We've covered a lot today, but remember, you're not alone in this. If you have irregular periods, excessive hair growth, or trouble conceiving, consult a doctor for proper diagnosis and treatment. Thanks for watching Molan Health. Don't forget to like, share, and subscribe for more health tips and information.